This podcast was produced by OAR FM Dunedin with support from New Zealand On Air.
Welcome to Headscarves and Good Yarns with me, Amal Abdullahi. The show is all about talking about race, diversity and everything in between, all in the hopes of empowering a more empathetic Aotearoa. We talk about all these huge life things through the lens of people's lives and stories. I hope every yarn you take a wee gem from it and expands your heart and mind just a wee bit more. Kia ora, assalamu alaikum. Welcome to another episode of Headscarves and Good Yarns. I cannot believe that I'm recording the second to last episode for this year. That's absolutely insane. I feel like this year has gone by hella quickly. It's gone by so fast, and I don't know what I'm going to remember 2024 for exactly. I haven't had time to decompress and process this year just yet, but it's been a big one, and it's been a big year of even more learning and unlearning, and I feel like the lens in which I use to view this world it just keeps on becoming more textured, which very, very grateful for, and hopefully this episode will add another layer or texture in which to the lens in which we view this world. Last episode we were kind of talking about body positivity, health, fat phobia, and what's happening with, body trends kind of changing again. I feel like, back in the day when I was a teenager, it was the Tumblr girly. I feel like now it's about TikTok and Instagram, but, before we had the body trend of slim thick, and now we're moving into, celebrating thinner bodies. And it's strange that bodies are a trend like that. I think life is lifing. It's already to adult and to be with family and friends and show up for the kaupapas that we're invested in. That's way more important, and that should take up our energies, not focusing on what's a trend. But anyways, the trend at the moment is celebrating thinner bodies. And so what does that mean for the body positivity movement or the body neutrality movement? And then we kind of finished the episode talking about fat phobia and our definition, or just kind of challenging the definition of health. And I think one thing with this episode that I really, really want to emphasize is understanding that our health system, and also just the way that we view health, it exists within the context of systems that already exist, right? Systems of whiteness, systems of class, systems of gender, and all of these other systems that our health systems, and I suppose therefore the way that we define health, kind of comes from that space and from that energy. And I think it is so embedded into how we think about health. I just don't think it's something that we're aware of. For me, I kind of touched upon this in last week's episode. For me, especially when I was an impressionable young woman, all I really wanted to be was skinny, and to me that meant being healthy. And one thing, there's a particular era of my life which I was oh gosh, yeah, I really thought I was striving for health. I don't know if y'all remember the vegan movement, and there was the raw tofu movement. And if you haven't heard of it, basically the raw tofu movement was eating raw food until 4 p.m. So food that wasn't cooked. So you're just eating like an insane amount of fruit. Like I think I'd start the day off with like a banana smoothie with like 8 bananas in it. Yeah, I wouldn't do that now. And then lunch was usually like a huge salad. And then you'd have like your cooked meal for the day after 4. And you'd, have like baked, kumara or something in the evening. I don't know. It was a whole shebang. And the way that it was spoken about on the internet, it was kind of, I could tell in that moment, now I'm thinking back on that moment, I could see how I thought that I was being really healthy and, but at the end of the day, the motivation was just to live in a smaller body. And again, with this episode, I'm not wanting to shame any body size. I think health can look so many different ways. But I think as a society, the way that we have equated health to living in a thinner body without actually thinking about, how health is, bigger than that. And how that definition of health kind of sits within fat phobia, how it sits within our systems of whiteness and the patriarchy and capitalism and individualism. You can see how when you it's like undoing a braid. You just need to figure out one bit and then, the rest of the braid comes undone. And I think especially in my 20s, that braid was being undone for me. And I could kind of see how my definition of health was being influenced by so many different things. And it was so embedded into how I thought about it. Because I think if the raw till 4 thing was brought to me now, I would be like, I'm not too sure. Like, I would be questioning how healthy that is because, now that I'm a bit older, I'm like, oh my gosh, like, where's the protein? And like, was it actually healthy for me? Like, I just remember my stomach was upset all the time and I just actually wasn't feeling well in any way, shape or form. But I thought that I was doing the right thing because, everyone promoting this diet had the same body type. And I was like, well, great, they're healthy. That's what I want to be. And I think when we are unpacking health, I think the thing that we really need to remember is that a health system is already based or sitting in our existing societal systems. And these systems are very good at telling us that, telling us certain things about certain communities, their sense of humanity, their sense of worthiness, I think we need to understand that. And I think when health, the definition of health sits within these systems, the narrative of health then changes to amplify these stories that these systems are already telling us about people. And I think, when we are all doing the work and learning to learn and unlearn, that we can get to the point where we can see health for how it truly should be understood and seen, and not just kind of swallowing this story about health that these systems amplify. And I think that's really important. And I hope with this episode I can demonstrate that the way that we think about health actually isn't really healthy at all, and kind of fits within the paradigms that these systems already present to us, and B, hopefully leave you with some food for thought about how we can learn and go from this, and then and go from there. And I want to start this episode by talking about this article that I found on the Ministry of Health website, and it's a fantastic fantastic article. I don't know the author's name on the website. It just says written by Ace Time Lord. But it's someone being very vulnerable about their experience with living in a bigger body, and their experiences with being a fat person in our medical system. And there's this particular part of this article which is very confronting, because they share a list, and it is a meaty list of how they have been treated by the medical system, and they've had medical problems which haven't been attended to properly because whoever they were interacting with in the health system was not able to see the issue for legitimately what it was and stopped at their weight. And so I just wanted to share a couple of these examples. So, having to learn from the radio that a longer needle should be used for plus-size people getting the COVID vaccination, and then being told by multiple vaccinators that they were wrong, and then they had to ring the National Vaccine Information Centre, which wasn't open to the public to actually get that information confirmed, that plus-size people were not getting full coverage of the standard needle size. Another example, they were told by a junior neurologist that their neurological condition was caused by their weight, and got referred to a dietitian instead of, getting an MRI or being referred to an expert, or more senior neurologist or a neuro-ophthalmologist. And then when they eventually got the tests and the expert help they needed, they were told that there was absolutely no correlation between weight and the medical condition that they had. And then another example, they wanted to get their blood pressure checked. They went to multiple pharmacies and then eventually to a doctor's clinic to get access to a plus-size blood pressure cuff. And then they were not believed when their results were higher, because they just had run all over town to get access to a plus-size blood pressure cuff, and were humiliated by the pharmacy staff who tried to painfully put their arm into the quote-unquote standard size cuff, and then had to go get their blood pressure checked with yet another doctor's visit. My goodness. And then the list is long, so I'll make this the last example. But the last example that I share is getting a knee ultrasound for an injury that had nothing to do with their weight. And then being told by the ultrasound technician, you have a lot of arthritis in your knee. Do you know what you weigh? And then, they were left with the belief that they had a lifelong degenerative condition. And then they did their own research and discovered that due to their age, it would most likely be caused by a genetic autoimmune disorder. And while weight loss is recommended to reduce the pressure on the joints, it's not the cause at all. And then later discovering from the doctor that arthritis can't be diagnosed by an ultrasound, which is insane. And this is a real life example from a human just navigating our medical system, not some system overseas, but our medical system here in Aotearoa. And, just even from those examples, it's just screaming loud and clear, like all of those interactions that they had with, all the engagements they had with the health system in those examples just shows that there was a very narrow mindset of what health means. And I think if we talked about what it means to live in a big body, what it means to be fat, and take the fat phobia away from that, then I think our definition of health would be not so narrow. And if that was the case, then whoever who wrote this article, they wouldn't have had the experiences that they've had. And I think, we think that if you're in a position of being a doctor or you're in other positions of power, that perhaps that wouldn't be the case. But you have to acknowledge that, people who are in positions of power, including people who work for our healthcare systems, are also people at the end of the day. And if we've all been fed this story so much about, about fat people, and if fat phobia is so, it's just present everywhere in our society, then this story will also be regurgitated by people who are in positions of power. And I think we need to be so real about that. And I know it's really uncomfortable to acknowledge that, but if we're not going to be 100 about that, then I'm dubious as to how much change can really happen. But we need to be so real about that fact. And when I say, we've been fed these stories about what it means to be fat, and we've been fed stories of fat phobia, it sounds really obvious in the moment, but I really want to emphasize that we've been fed these stories so much, most of the time we're not even aware that we're looking at this world from and using those stories as our point of reference. We're not, our actions are coming from this unconscious place, and in that unconscious spaces is where these stories lie. That is how embedded these stories are, and we need to go so deep with our learning and unlearning that these stories are no longer part of our subconscious. They're no longer part of our, invisible thinking about this world. Because, the fatphobic society that we live in is horrible. And, because of this fat phobia, there is this very narrow definition of health, and people who live in bigger bodies will never be seen seriously for, the health issues that they have, if everything's going to be attributed to their weight. And when you think about our definition of health, on one lens, it's influenced by fat phobia, but there is a lot of other systems that influence how we see health and how we see how we see who can be healthy, and how we, assess, when people come to us, or we see things, and in our decision-making process of deciding of whether or not it's healthy, it's not as pure as we think it is. It is absolutely influenced by the systems that we live in, and the systems that have impacts of all other areas of our life. So it would be silly to think that health wouldn't be part of that. And I wanted to talk about health and whiteness, or white supremacy. And I found this fantastic book. It's called Systemic: How Racism is Making Us Ill, written by Leah Liverpool. And I think, I would recommend this book to everyone. But one of the stories from this book that really jumped out to me was when the author Leah was a teenager in the Netherlands. She noticed that she was losing small patches of pigment on her face and arms. And, went to the doctors and was prescribed all of these antibiotics and antifungal medications, but nothing really helped. Her skin still had pigments, patches of pigment loss on her face and arms. And so, because nothing was working, the assumption from the health professionals that she had seen was that, it was a very rare and untreatable condition. She then went to a dermatologist in the UK who also had dark skin as well, and found out that the small patches of pigment loss was eczema. And the dermatologist that she had met in the UK, this dermatologist said, well, it's pretty common in their field to notice that, skin conditions might appear different on darker skin, and that is not well taught or acknowledged. And oftentimes patients with darker skin often have a misdiagnosis. And so yes, I think, that story really jumped out to me. But essentially what the book is looking at is looking at the health gap between people in marginalized ethnic groups, and comparing that to Pakeha communities, Pakeha groups, and just talking about the difference in the health gap and ways that we might fix that. And the inspiration behind the book was like the author's experience and people who looked like her and their experience. In the book, Leah was talking about how she has become a mum, and in the UK, black women are 4 times more likely to die during pregnancy and childbirth compared to white women. And another thing that I thought was really interesting that the author was reflecting on, Lyle was saying that she thought she knew a lot about this topic, but in the process of writing the book was really shocked by what she had discovered and learnt. For example, she found that marginalized racial and ethnic groups in many countries around the world are experiencing far worse health outcomes in many areas besides maternity, like infectious disease, like cardiovascular disease, cancer, mental health conditions. And so as you read the book, it kind of becomes quite loud and clear that racism is actually a public health crisis. And we know that racism is a symptom of white supremacy, or racism is a result of white supremacy or whiteness. And then another thing that I thought was really interesting that's really highlighted in the book is that there is a lot of research out there that shows that medical students often have totally false beliefs about the biological differences between people of different ethnicities. For example, that research has shown time and time again that there's this false belief that black people's skin is thicker than white people's, and so their nerve endings less sensitive, and so there's this belief that black people experience pain differently. For example, and another example is, the guidelines to adjust kidney test results based on a patient's race, because there's this false belief that black people's kidneys work differently from white people's. And so how this came to be was actually there was this one small study, which was then cited by other studies, and then it came embedded into the guidelines. So it got, i.e., written into policy. And then there's been further research to show that this actually, that initial small study was came to incorrect conclusions. It was essentially poor science. And this is not, this is not the first time that it's happened. This has happened in lung function tests. There was a physician and slaveholder in the US called Samuel Cartwright, and Samuel had this idea that black people's lungs were weaker, and so they benefited from being enslaved, and so and this belief somehow got embedded into practice. So again, let me emphasize, this was written into policy, and it still exists now in some international guidelines, which is based, there's no basis in biology. It's not rooted in fact. But because we live in the system of whiteness, there's no way that those false beliefs would be checked. Because as I said before, these stories are so embedded in our thinking that it doesn't get checked. It's just seen as a fact of life, just like that. And if you think, oh, well, Amal, surely this isn't, a big majority. Research has shown around half of the medical students in America believed some of these false ideas. 50%, almost around half. That is a huge percentage. And so you can see that when these medical students then graduate and become doctors and become people who have positions of power in our healthcare system, they have a definition of health which has been influenced by our system of whiteness, and have these false beliefs around what is healthy, who can be healthy, which is absolutely insane. And so, when I say these things, it sounds so grossly wrong that surely in 2024 this is just not a thing. But I'm telling you, in 2024, unfortunately, it is a very real thing. Our definition of health is not often based in biology or based on evidence or facts. It's influenced by our systems, and all of these systems are, social constructs, systems that prioritize certain communities and have, particular priorities and wants and needs that actually have nothing to do with what is well and what is healthy for that person, but, what is well and what is healthy for this particular system. And so, these examples show that actually it's not just, there are so many factors factors that kind of lead to the disproportionate stats that we see across the world and here in Aotearoa. We know that our stats for tangata whenua and tangata moana are, they're not great. There is, poor health outcomes. They're very disproportionate, and there's a very high number of Māori and Pacifica peoples represented in those stats. And, often when we talk about these stats, yes, I think the conversation around inequities and health gaps come up. But I think one thing that we don't talk about enough is that a huge part of that picture of those statistics is the fact that our very definition of health is impacted by our systems. If we take a step back from this kōrero, can you imagine what our health system could look like if we had a definition of health that we all operated from and processed this world with? This definition of health, if it had zero influence of fat phobia, if it had zero influence of whiteness, if it had zero influence of colonization, our class system, the patriarchy, our culture of individualism, can you imagine what that health system would look like? And I think these experiences that people from marginalized communities wouldn't be a thing. And so, a huge part of that is our very definition of health. And, hopefully later in the episode I can start to talk about what is it that we should be thinking about to move away from this understanding of health and what work we should be doing. But it's absolutely insane. So if you're wondering what book it was, Lyall, Liverpool, the book is called Systemic: How Racism is Making Us Ill. And another thing about the relationship between health and whiteness that I really want to emphasize is that our whiteness and white supremacy is so embedded in our health systems that the policies of our health system, the values of our health system are built on whiteness. Just to give you some examples of actually what that looks like is excluding the perspectives of marginalized communities in our health systems. Another way that this manifests is that not accounting for or including the experiences of discrimination or colonization or police brutality in our health system, and how those things actually impact one's health. It shows up when the way that the Western way of thinking about health is considered the norm, and that is not the norm for everyone. And I think another thing to highlight in the relationship between health and whiteness is that our health system is built on the idea that whiteness, and along with other things like individualism and capitalism, leads to direct benefits. And, I think that way of thinking kind of infers that there's a sense of superiority there. And that's one of the key tenets of the system of whiteness, is that there is communities that have this sense of superiority compared to marginalized communities. And there's a sense of superiority there with that idea, right? Because it's saying that this way is the only way, and this way is the only way that leads to direct benefits. And so when you see that there is that relationship there between our health system, our definition of health and whiteness, then you can see how our definition of health is being impacted, and I think that's really important to acknowledge that reality, because it sounds, when I'm saying it like this, it sounds really strange to be having this conversation in 2024, but I think our progression still has a long way to go, a really long way to go, and the levels at which we still operate on whiteness, it exists on so many levels, and I think it's really important to unpack that a lot. And I think when we do talk about white supremacy, I think it's important to acknowledge like how global it is. I'm casting my mind back to 2020, and I'm just thinking about the global reaction to the murder of George Floyd, and I thought it was interesting, the global reaction to it, because it's not just something that is specific to America. I think when you think about all the countries in the world, I think you can say, it would be hard to say, it would be hard to disagree when I say that, every country has been touched by white supremacy, whether it's through, its sister systems of colonialism or slavery or apartheid. Like, the influence of white supremacy is everywhere. And so the insidious, I think, story that white supremacy sells is that non-black groups, let me rephrase that. The way that white supremacy centers whiteness is, that means if you're not actually white, the more that you can get closer to that center of whiteness, that in itself upholds the system. And I think that is really eye-opening, because it just goes to show that this is a conversation that we all need to be involved in, because there's, in the system of just any kind of system, there's no such thing as being a passive observer. And again, I know all of this is really uncomfortable to talk about, but I want to say that in our one being, we all have our own individual sets of privileges and lack thereof. And in certain systems, we are the one with power, and in other systems, we don't. But the truth of the matter is that we're not just passive observers, and unless we do the work to really get deep and to acknowledge our power and our privileges, it's fair to say that we are complicit agents in upholding a particular system. And I think one thing that we do need to be talking about a lot more is like our ideas of health and where it comes from, and just unpacking the health system and doing so. And I think it's so hard to actually have this conversation, because this system is so powerful that it's very easy to be rewarded to conform to the system, and when that happens, it's very easy to be blind to its influence, which is insane. I mean, this is a bit of a tangent. It doesn't quite directly relate to our definition of health. But when I was doing research for this episode, one thing that I thought was really interesting is global health, or, you know, tropical medicine, as that's what it was called in its early days. Why does that even exist? So tropical medicine came about initially because it was to ensure that white people wouldn't die in malarial or yellow fever ridden zones, so that, you know, the interests of whiteness could be exploited, which is insane. And so even now, it kind of like places that receive international aid are prioritized based on their relevant importance to groups of donors, which most of the time are, you know, white-led governments and foundations. And so it's interesting because then it kind of poses the question of, like, in the global health sector, which is dominated by white people, you know, how does the system of whiteness know how to solve health problems of people in other countries? And it kind of like feeds this saviorship, which is insane. Yeah. Which is insane. But anyways, that's kind of a tangent to what this episode is talking about. But I think it's interesting that our definition of health is very much influenced by these systems that we navigate in. And like anything else in life, these systems have existed for so long that, you know, you are rewarded for your participation in it. And there's this like sense of, you know, there's a sense of, you know, the closer that you are to the center of the system, the more that you are rewarded for it. And it just goes to show that this conversation is relevant to all of us, and relevant to it's important for all of us to be having this conversation. And I know that I've spoken a lot about whiteness and fat phobia in this episode, but I just wanted to emphasize that this definition of health is influenced by, you know, all of the isms and in the systems that we live in. You know, the narrow view in which we view our disabled community. You know, there's not a lot of evidence of dignified healthcare in our current health system. The way that class has a really big impact on, you know, what health means, what health can look like, is really big. I've already spoken about the impacts of white supremacy and fat phobia, but, you know, there's also colonization. There's also, you know, the history of slavery. Like, all of these things feed into how we think about health. What is healthy? Who can be healthy? And then all of these false stories about what impacts people's health and what is or isn't healthy is produced, and we just get fed these stories so much that they become some kind of concrete truth in our minds. You know, even just this episode has got me thinking about when I first started going to school. I just remember, like, the school lunches that my mum would pack for me at the beginning of the school year compared to what she packed me at the end of the school year. You know, we were there was this idea that, okay, there was the racism of our food just being really, yuck and gross smelling. I got that a lot, but there was also this sense of, a healthy school lunch looks a certain way, and that certain way was just very white. It didn't accommodate for one's cultural foods. Now that I'm saying this out loud, just like, if there's any biological basis for this, okay, come at me with some evidence. But, just this idea of like white rice being not healthy at all. And, my husband is Malaysian Chinese. He loves his rice and he is healthy. And, the way that we're taught about health, it's like white rice is like the devil. And so you can see how health is just being influenced by, the definition of health can be influenced by so many things. And I think one key thing, because I do not hold all of the answers as to, what health can look like. But I think one important thing that we do need to work on is that to have these conversations, to unpack the word health and the definition of health, we need to build our emotional stamina to have these conversations. And when I say emotional stamina, what I'm saying is that, these conversations, they are really hard. They are really uncomfortable. It brings up so many emotions and responses because there's some really hard, uncomfortable truths that we need to acknowledge when we do have these conversations. For example, emotions like being defensive, guilt, shame, emotions around potential privilege, quote unquote loss. Like having these conversations, yes, evidence is really important, but it's actually really emotional as well. I'm just thinking to any time I've had a really difficult conversation, trying to, whether it's about, any of the isms, these conversations are just as much about emotion as they are about evidence. And we need to have the emotional stamina to have these conversations for what they are. Because if you're having these conversations, and I'm not saying people's feelings are invalid. I mean, these feelings do come up. But, because you have these feelings, does that mean that this conversation isn't important or it isn't useful to have? No. Or, just because these feelings come, I'm just thinking when these emotions come up, they often come up and come at the cost of, the valid and legitimate plight or concern of those who don't have the power and are the marginalized community in that case. For example, just to, give more context to this, all of the conversations that we've been having since this bill has come out, I think the sense of fragility that comes through in all the emotions that come through when having these conversations about the bill, it invalidates the very real struggles of tangata whenua and invalidates it where to the point where it's like, well, we don't, this conversation is not relevant, and then it becomes something else entirely, which is so not fair. And I think, to have these conversations, we need to have the emotional stamina to have these conversations about for what things truly are, without letting those feelings be so center point that we have these conversations through the lens of those emotions. Like, for example, what kind of productive conversation you can have about racism and health and whiteness if emotions of guilt and emotions around potential privilege loss are coming through. It's not going to be a full-bodied conversation. It's like the same idea around, like, when you're trying to have a conversation with someone, there's no point in having that conversation when that person's heated. They're not really going to see you and hear you for what you're trying to say. And so it's the same thing here. I think we need to be building up our emotional stamina to have these really hard conversations. And also another thing that I think we need to be doing is being able to self-reflect and process beyond the simple declaration of, like, yes, I have this privilege, or no, I don't have this privilege. And particularly if, you're saying, like, yes, I have this privilege, I acknowledge my privilege, what you really need to be doing is getting deeper with it. So what is, how does this privilege actually show up in your life? What spheres of influence do you have in your life that you could change? We need to be going deeper than just, like, declaring, like, this is what I got. And so again, I don't have the solution to everything. I think the solution lies in having those hard and uncomfortable conversations. But I hope this episode has given you some food for thought and a couple of nuggets to take away. Thank you so much for tuning into this episode of Headscarves and Good Yarns, and catch you for the last one of 2024 next time. Kia ora.
Thank you for tuning in into another episode of Headscarves and Good Yarns. To keep spinning the yarns, let us know your thoughts. You can find us on Facebook and Instagram at Headscarves and Good Yarns, or email us at headscarvesandgoodyarn@gmail.com.
This podcast was produced by OAR FM Dunedin with support from New Zealand On the Air.